Welcome to another Hot Topics episode of the Dr. Youn Show. I'm Dr. Anthony Youn, and today we're going to be covering some really interesting hot topics. We're going to be talking about Looksmaxxing. If you haven't heard of that, I guarantee you your teenager has heard of it and knows a lot about it. We'll talk about a 30-second face washing rule. We'll talk about a treatment that a plastic surgeon says that they would never recommend on anybody. We'll talk about a mini lunchtime breast job and Kelly Ripa's recent, cheek enhancement procedure. Okay, so I'm joined this week with Dr. Emily Levin. Thank you for joining me.
Yeah, love being here.
So Dr. Levin is a dermatologist in the Metro Detroit area. If you can explain what your practice is and the type of dermatology that you practice.
Yep. My name is Dr. Emily Levin. I am a dermatologist in private practice in the suburbs of Detroit, Michigan. I practice general dermatology. My practice is called Northwest Dermatology Group. We have a medical spa. I mainly see full body exams and mole screenings and skin cancers. And then I also have a med spa where I do a lot of cosmetic work as well.
All right. So we're going to start by talking about the first article here, and it is from Real Simple. Heather Muir-Maffei wrote an article. A dermatologist taught me this 30-second face washing rule, and my skin has never looked better. As a longtime beauty editor, I've interviewed countless dermatologists about cutting-edge treatments and buzzy new ingredients, but I was genuinely surprised to learn I'd been getting the most basic step wrong. The fix isn't expensive or complicated. It doesn't even require a new product. It just takes 30 seconds. It turns out the biggest cleansing mistake isn't using the wrong product. It's not giving your face wash enough time to actually work. When you rinse too quickly, you're not just pouring money down the drain. How long you should leave your cleanser on is about 30 seconds is ideal, says Mona Gohara, MD, clinical professor of dermatology at Yale School of Medicine. That gives the surfactants in your cleanser enough time to bind to the oil, dirt, sunscreen, and makeup so they can actually lift them off the skin, she explains. If you rinse too quickly, those ingredients don't have a chance to do their job. If you're washing faster than that, you're basically doing a skincare speed run and missing half the clean. I always do speed runs whenever I wash.
Sometimes I do too, depending on how late it is.
So this Heather Muir-Maffei actually did try the 30-second rule, and she says that the difference was immediate. The faint makeup residue that used to show up on my toner pad post-cleanse was gone. Those extra seconds help fully whisk away leftover makeup and sunscreen. After a week, my skin looked clearer and, dare I say, glowier. I'm not especially acne prone, but I can only imagine how much more impactful this would be for someone who struggles with breakouts. So do you recommend to your patients a 30-second rule of using cleanser?
Well, I like this actually because I do recommend that they do a good deep cleanse. I've never really said 30 seconds exactly, but definitely a quick cleanse is not going to be as good as removing everything except a little bit of a longer cleanse. So I say take a little time rubbing in your cleanser, really scrubbing it on, kind of going all over your face with it, almost giving yourself a face massage. Mm-hmm. And then go ahead, let it sit for a minute, let it lift everything up, rinse it off. And that's what I do with mine.
So you don't think it's enough for somebody to take 30 seconds where they're massaging it in, but to actually leave it alone for 30 seconds as it burns your eyes?
Right.
And
kind of a combination. And you don't have to do your eyes right away. You can usually use an eye makeup remover or something like that. But yes, I use about 30 seconds. I don't usually sit there and count because I'm a lumper, not a splitter, but I do like a massage and then kind of scrub it around. I would say it's about 30 seconds.
Does your husband, Peter, give it a 30-second wash too?
I'm going to throw him under the bus. He doesn't wash his face at night. Oh my goodness. I just
all?
said that. No, he doesn't.
What is a husband of a dermatologist doing not washing his face at night?
He has no acne. He has great skin. He won't let me touch him with Botox.
So he washes it in the morning.
He just washes it in the morning when he showers. Just when he showers. That's it.
That's it.
That is it. My low maintenance husband. Different things work for different people, Tony. That's all I can say.
You and I were talking. We both have lake houses, like cottages on lakes. And so if he's at your lake cottage and he's out on the boat and he's jumping in the water and all that stuff, then he gets in bed at night. He does not wash his face.
Correct.
He's got lake water and
sunscreen,
fish poo-poo and pee-pee all over and sunscreen all over his face, and he goes to bed that way.
Yes.
That is crazy.
Isn't it? Should we have an intervention with him?
I got to give him a call.
I think we need an intervention.
Wow.
And his skin looks amazing, and people always think he's younger than me.
Yeah, well, I don't.
He is younger than me by 2 years, but doesn't matter. The point is they think that I'm his mother sometimes, and that's a problem. So I'm gonna let
lake
him
water.
Lake water, sunscreen. He considers the lake water bathing.
Oh my gosh.
Yes, he does.
That's my kids when they're in middle school choir camp. Is they would think, oh well, I'm like, how many times did you shower? None, but I did jump in the lake almost every day.
That's what my husband is like. So what can I tell you? He has no breakouts. He's got great skin, barely any wrinkles.
If I jumped in the lake and I went to bed without showering that stuff off, my wife she would kick me out of bed. She'd be like, yeah, you're not sleeping here tonight.
Yeah, no, it just shows you different strokes for different folks. And I'll tell you, my husband, skin is great. Hasn't gotten ill from the lake water yet, nor any skin rashes or anything. I know.
Maybe
Crazy.
he's part salamander or something. He's got some of that DNA. If you're a parent, you know how easy it is to put your own mental health last. You're focused on your kids, your schedule, and everything else going on. You keep showing up for everyone else, but there's barely time left for yourself. Well, even when you do decide that you want support, finding a therapist is hard enough. But finding one who actually takes your insurance, that's where most online therapy platforms fall short. Many don't work with insurance at all, which means that you're stuck paying out of pocket or signing up for an expensive monthly subscription. Many don't work with insurance at all, which means that you're stuck paying out of pocket or signing up for an expensive monthly subscription, which just isn't realistic for a lot of families. Well, Rula does things differently. They partner with over 120 insurance plans, making the average copay just $15 per session. That's real therapy from licensed professionals at a price that actually makes sense. Think about it. You use your insurance benefits to take care of your kids and your physical health, so why wouldn't you use it for your mental health too? Rula also makes sure that you find the right therapist for you based on your needs and preferences, not just whoever is available. No wait lists, no frustrating back and forth. Appointments can be available as soon as tomorrow. Because sometimes showing up for your family means taking care of your mental health. Thousands of patients are already using Rula to get affordable, high-quality therapy that's actually covered by insurance and helping them and their families. And so can you. Visit Rula.com/Dr. Youn to get started. That's RULA.com/DRYOUN. Okay, so the next article is from Fox News by Amy McGorry. Doctors warn of Looksmaxxing dangers after influencer's live stream emergency. Clavicular, the controversial Looksmaxxing influencer, was reportedly hospitalized due to a suspected overdose Tuesday night during a live stream. What is Looksmaxxing and why is it trending? Looksmaxxing is a social media trend focused on enhancing appearance, ranging from basic skincare to extreme practices like hitting cheekbones with hammers to alter facial structure. The potentially dangerous trend has been popular with young males. In my practice, we've seen it primarily in young men in their 20s, Dr. Joseph Hadid, a plastic surgeon in Beverly Hills, California, told Fox News Digital. Looksmaxxing can be divided into two categories, soft maxing and hard maxing. Soft maxing is a more simple, non-invasive approach to improving one's looks. It's really like self-care grooming, things like going to the gym on a regular basis to improve your body composition or using various skincare products to try to improve your skin texture, the surgeon said. Hard maxing, which involves more extreme procedures, can have riskier consequences. Some individuals in the Looksmaxxing online community do things like bone smashing, Hadid said. It's literally what it sounds like, where you smash the bones to change the facial structure, and that is obviously not recommended because it can lead to potential complications, he warned. The convergence of social media, constant digital visibility, and unprecedented access to aesthetic treatments, along with a cultural shift towards optimizing wellness and longevity, are fueling the Looksmaxxing trend, according to Bob Basu, who's president of the American Society of Plastic Surgeons. Anyone considering this trend should consult a licensed healthcare professional rather than relying on the advice of social media influencers, the doctors advised. So, prior to reading this article, were you aware of Looksmaxxing?
I had heard of Looksmaxxing.
So did your youngest son?
Teenagers.
Did he tell you about Looksmaxxing?
He did not. It was my older two kids have told me about it. Yes.
So Clavicular is well known, I guess, social media gaming influencer who is probably most well known person in the whole Looksmaxxing community. And the idea behind it, my understanding, and correct me if you know more information. Here are two Gen Xers talking about Looksmaxxing. Right. But basically, there are incels, which is a term used for typically young men who are honestly kind of like losers. So incel means involuntary celibate, involuntarily celibate. And I think that a lot of the Looksmaxxing trends started there, where men or boys basically think that they are unworthy because most women are only attracted to a certain type of guy. And so these young men basically undergo all of these things, from excessive exercising to sometimes unregulated supplementation and all these things. And now they're even taking the final step to undergoing cosmetic procedures, which you and I, dermatologist, plastic surgeon, we kind of do looksmaxing for our patients, but we do it safely. But they're doing it not safely. So one of the things that they do is they'll take a hammer and literally hit their bones of their face with a hammer, because they believe that if you damage those tissues, that you can get scar tissue that will essentially add volume to the area. So if you want higher cheekbones, instead of getting injectable filler from you or I, they would hit their face with a hammer to eventually create scar tissue to cause more volume in that area. And it's just this kind of, it's out there, but all the young people know all about it.
Yeah, it's shocking, quite honestly. But I mean, it's the semantics of it are, obviously we do some of this looksmaxing, right, for our patients or whatever. We just cosmetic enhancements and improvements.
Yes,
it's a version of it, but it's an extreme version of it, and a frightening one if they're doing things. I mean, you cringe when you read about them hitting hammers on their cheeks to create.
Well, and there are videos out there of some of them injecting black market filler and stuff like that into people's faces, and actually into other people's faces too. So it's it's kind of a frightening phenomenon. I think there's did you ever watch the show Adolescence?
I did not watch it, but I've been told I should.
Really interesting.
Yeah.
Now, the two interesting things about it. It won a ton of awards.
Yeah.
One interesting thing is each episode is filmed in continuity. So it's like a half-hour episode, and it's about a young man. I mean, he was probably a boy, maybe he's 14, who gets arrested for murdering a girl in his class. And it follows basically what happens when he gets arrested and then through basically going to trial. And every episode, the camera follows it. The camera never takes a break. It never stops. It literally, everything was set up prior to the filming. So going from one house to another, one person to another, it's a continuous filming each episode. It's crazy how they do it for a whole half hour. So you can't like stop and do another take because you just spent the last 25 minutes doing all the other scenes.
Crazy.
But it really is the story of this young man who you later find out gets kind of into this community where it's a bunch of young men who are bitter, and it really is a very toxic kind of online underground type community. Yeah. And that's, I think, a lot of what we're seeing with this kind of whole looksmaxing thing. It
plays into the whole body dysmorphic disorder, which is the low self-esteem that translates into body dysmorphic disorder for a lot of patients or people that we know. And but with that, obviously mentally susceptible age group, I think is a very, it's just almost giving it a name and giving it like, credibility, and like an acceptance, which is what's really frightening about it.
I think what's important, is that our listeners are not looksmaxing. We don't have listeners who are in their teens, but we have a lot of people who probably have kids listening who know about these people and know what's going on. And maybe, and I think with this show Adolescence, basically the parents had no idea that this kid was, so miserable and was being bullied and, felt this way and could resort to these to violence. And I think that's important for people to realize is like, see what your kids are involved with. Ask them if they know about looksmaxing. Ask them if they know about this stuff, because a lot of them may just be unaware. Especially, like I said, these young boys, I think that's kind of what this whole looksmaxing trend is, and it's mainly in that kind of incel community. Yeah.
And of course, if there's a safe way to do all of these things, if it's in a healthy, normal way of doing it, that, to see a medical professional as opposed to turning to social media.
Yeah, and definitely, talk with your kids to see if they're taking some of this, because they're giving advice on how to take certain types of drugs, on how to do these types. We laugh about taking the hammer to your cheeks. It's so ridiculous. But once again, that they're doing things that are just things that you would think, oh, of course they're not going to do it. And they do. So, okay. Next article comes from People Magazine from Joanne Jeffrey. Man gets cosmetic treatment to address his biggest insecurity. How the 30-minute procedure changed his face. Davis, who posts under the Instagram account Andrew Davis with his husband, says that this is the biggest insecurity he's ever had as a gay man in his 20s. In a video, he explained that he's been insecure about his double chin for as long as I can remember. In the clip, Davis showed off different angles of his face before he went to get Quantum RF, a skin tightening procedure done. Quantum RF is a minimally invasive procedure that uses radiofrequency to tighten skin and reduce fat. It uses heat to stimulate collagen while breaking down fat and is commonly seen as an alternative to liposuction. It was so quick. I think he did it all within 30 to 40 minutes. I saw all the fat that came out and I was actually shocked, he said. He explained that the procedure cost him about $2,000. So are you familiar with Quantum RF?
I am, yeah.
Tell us about it.
Yeah, Quantum RF is a radio frequency device that basically is inserted right underneath the skin into the fatty tissue. And using that radio frequency, it sort of melts away the fat and kind of dissolves it and does it liquefy it. I don't do the procedure myself, but kind of liquefies it and then can be extracted or just metabolized by your body and removed. We do it on the surface. There's other versions of radio frequency you can do on the surface, but this is a particular one where it's underneath the surface of the skin. So it really targets those fatty areas. I don't do it myself personally. I don't know. Do you do the procedure?
No, I mean, I have done. So I feel like this is... Every so many years, there's a new category of minimally invasive treatments that try to heat the skin from the inside. And then they make all these claims that it's going to create all these changes. And then it doesn't. And then there's another category eventually comes around. So for me, I look at this, the first generation of these treatments was probably Vaser, which was ultrasonic liposuction, where you would have a cannula and the end of the cannula would vibrate really quickly using ultrasonic energy. And what it would do would basically be melt the fat before you suck it out. And the idea was that by melting the fat first, you may have a little less bleeding because you're using heat. Maybe you can maybe create some tightening of the skin. And it really didn't do that. And now there's still some doctors who still use Vaser as a way to kind of get through certain like fibrous tissues when you lipo, but really isn't being used that much. Then the next group came by, which I'm sure you remember, is laser liposuction, smart lipo. There was like all these different names. It's cool lipo, smart lipo. I had one called lipo light. And it's just all these names. And essentially it's the same thing. You stick a probe under the skin and that probe has a little laser fiber and emits heat at the end. And so they say, oh, now you're heating up the skin and you're melting the fat. It's less invasive, blah, blah, blah. And it tightens skin. And then you find out it doesn't tighten skin. And if it does, it's so tiny amount that you hardly even notice. So now there's another group out there that uses radio frequency that does the same thing. So there's this one, Quantum RF. There is Face Tight, which uses RF on the surface and on the inside. And then there's a treatment now called Renuvion that uses plasma energy on the inside as well. And they're all the same idea. It's like you create this heat underneath, you tighten up the skin, and how much tightening do you really get? My feeling with it is a couple things. The first thing, there's some doctors now who are talking online that they will say, do a facelift on somebody. If they've had a treatment like this, now they have to cut through all the scar tissue, and that could make their facelift have a higher rate of complications, possibly higher risk of unevenness and stuff like that, which I think there's some validity there. So that's the first thing is, are you setting yourself up in the future for not a great result if you do have actual surgery? And then the second thing, is there a risk of burns, of course, with it? And are you really getting skin tightening or are you kind of imagining it?
His results look pretty good. If you see the pictures in this article, they look pretty good. But at the same time, I agree with you. I mean, it's like newer and newer generations of the similar. I mean, the concept of liposuction works, right? Yeah. You know that it works. So now we're just kind of enhancing that with heat, with radio frequency, with ultrasound, whatever it is. And if you're not seeing that it's really enhancing the effect of it, then why not just kind of go back to regular liposuction, And because is that less of an issue when they possibly go for a facelift later? Is that, maybe there's a little scar tissue still, but not as much because you're not heating the tissue. And
that would be the belief. I don't know that that's true or not. I would not be able to look at a tissue and necessarily say, oh, well, this is a lot worse because of the heating that was done. Yeah. Although I do think there are times where I have seen some patients who've had, let's say, laser lipo, and they've had a lot of unevenness and stuff, and possibly areas where it does appear like it's stickier than it would be if it was just regular surgery. But we don't know for sure. I don't know if any studies have actually been done to compare it, but.
And this is done, Tony, as an in-office procedure, by the way. And it looked, I've seen it done, and it looks.
Do tumescent and.
But they do tumescent anesthesia, which is injecting. But with liposuction, do you do that as an in-office procedure?
If I do a little touch-up of an area, yes, I can do that. Yeah. If it's somewhere big, though, then I don't. And the submental, meaning the area, the double chin, I usually do that with the patient asleep. It's so quick and it's easy, and they're not going to be awake for it, and it just makes it easy.
Yeah.
Some people will do things like this in their office as a way to save money. Charge a patient a little bit less, makes them a little more competitive potentially in the marketplace.
Yep.
But I don't know. For me, it's not my deal.
Yeah.
I think that what I tell my patients, is that let's say you want a facelift. So if you got a double chin, then adding something like this to it, it's going to cost extra money. You may or may not get a mild improvement in the skin quality, maybe. But if a lot of people will try to do these things instead of, let's say, doing a facelift. And for something like that, you have to keep in mind expectations. And then the fact, once again, that you're spending still a lot of money. This is still an actual surgical procedure. Are you going to regret it in the future?
Right.
Yeah, it's not my thing, but I thought it was kind of an interesting article.
Yeah, it's not my thing either. I like my cool sculpting machine, which, is minimally invasive and gives me good results.
Yeah.
Not great, but good results.
And that's I think that's the skin tightening is what people are looking for.
Yeah.
And minimally invasive, non-invasive skin tightening has always been disappointing.
Yeah.
If you're going to do that, then my recommendation would do it in a small area, like the double chin area, just because if you get a couple millimeters of skin shrinkage, from the heat, it might be noticeable. But you do that in the abdomen and you get a couple millimeters of skin shrinkage in the abdomen, you can't even notice it. It's not worth it.
Agree.
So if you want to do a skin tightening treatment, look for small areas like the neck or something where maybe a modest change could be noticeable for you, where it may be worth it.
Yep.
But you want to avoid areas in general that are much larger, like the thighs, the abdomen, the butt, because even there, like I said, if you got a large area and you get a few millimeters of skin shrinkage, are you even going to notice?
Right.
Probably not.
And I think for listeners to keep in mind too, is just to not always think the newest laser is the best laser. We've become a little cynical, I think, in the years we've been practicing, but I think rightfully so, because so many new lasers come out and sometimes the old school ones work just as well. We've talked about this before.
And how many of these devices that were being used 10, 15 years ago have been thrown out. Nobody's using them anymore because we determined that, they're safe, but they don't do anything.
Right.
And that's the thing is you get this FDA clearance where you're cleared by the FDA, but not necessarily approved by the FDA, which means that if there are certain devices that are similar to other devices on the market, if you can prove that it's safe, then you can get this FDA clearance and now you start selling it.
Yep.
Well, that doesn't mean that it's effective at doing what it does. It just means that it's that the risks of it are in a reasonable range, essentially.
Do your research, talk to your medical provider about it, ask them their experience with things. I think that's the best.
Do you ever go out to eat and feel stressed or disappointed because you know that you can't enjoy the foods that you love without worrying how you'll feel afterwards? With Fodzyme, you can enjoy your favorite foods without the pain. Fodzyme is a tasteless powder that you sprinkle right onto your food. It helps break down FODMAPs, the hard-to-digest components in food that can cause bloating, gas, and pain before they cause discomfort. Think of it like Lactaid, but for garlic, onions, wheat, beans, cheese, and other common foods with FODMAPs. It mixes into your food fast, and it comes in portable packets that you can take with you everywhere. Just sprinkle, eat, and feel great. And here's what really sets Fodzyme apart. Every customer gets access to a free product consultation with a registered dietitian. Not a chatbot, not an FAQ page, an actual dietitian who can walk you through how to use Fodzyme with your specific trigger foods and can help you build a plan that works for your life. Fodzyme was created by Harvard-trained scientists and has been clinically studied. It was founded by an IBS sufferer who was tired of feeling uncomfortable after every meal. With Fodzyme, you don't have to restrict yourself anymore. You can go out to eat, travel, and share meals with family and friends without stressing about what's on the menu and how you'll feel afterwards. Now, I'm so excited to partner with Fodzyme and offer you 30% off your first order when you go to icaneatagain.com/Dr. Youn. That's icaneatagain.com/DRYOUN for 30% off your first order. Finally, you can enjoy your favorite foods without the pain. Just go to icaneatagain.com/Dr. Youn. Okay, this is from the today.com from Ariel Ciclate. The number one type of filler this plastic surgeon wants you to reconsider. Once out of financial reach and seemingly reserved for the rich and famous, Botox and other cosmetic injections are now available to pretty much anyone looking to slow the signs of aging. A plastic surgeon warns, however, that under-eye filler might not be the quick fix you've been looking for. If you're sick of the puffiness under your eyes, filler might give you the look that you want at first. But eventually, as it settles, you'll likely notice even more volume. What's more, the filler will congest your lymphatic system under your eyes, which naturally releases the fluid trapped there throughout the day. It will congest your ability to drain fluid and ease the swelling, Doherty explains, and so you're actually perpetuating the problem, or even making it worse, putting filler in there. Like puffiness, dark circles, exposed veins, and significant hollowness are often genetic, due to aging or caused by smoking or lack of sleep, says Doherty. In these cases, filler can accentuate discoloration and make veins beneath your eyes look even more prominent. Or the hyaluronic acid can migrate, forming noticeable lumps near your cheekbones. The ideal candidate for under-eye filler, says Doherty, is someone in their early 20s with slight under-eye hollowness, whose delicate under-eye skin has decent elasticity and whose body is more likely to adjust to the injected gel. However, the typical patient asking Doherty for under-eye filler is older, with changes beneath their eyes that are much more noticeable. That's when things can go wrong. So what do you do instead? Well, if your doctor determines you're a candidate for under-eye filler, go slowly and start with a very small amount. Doherty recommends 0.2 to 0.4 cc's of hyaluronic acid under each eye. For dark circles, Doherty says topical treatments, including acids, skin bleaches, and sunscreen, can make a big difference. Translucent skin beneath the eyes will respond to hydrating treatments, including topical hyaluronic acid. Peels, microneedling, and laser resurfacing can improve the quality and character of that skin too, Doherty says. For under-eye puffiness, the gold standard is surgery called lower blepharoplasty, says Doherty. So this plastic surgeon says that under-eye filler is the number one type of filler to reconsider. Do you agree with this article?
100% agree with this article. That is the most challenging. I love, I do a lot of fillers.
Yeah.
It's sort of my favorite thing to do to rejuvenate the face, a little Botox and fillers. But the tear trough or the under eye area is the most challenging, and it is a rare candidate that I will, patient that I will say, you're a good candidate for this.
Really?
Yeah, oh yeah, for sure. It is so challenging. And a lot of people see the puffiness under their eyes. I try very hard to convince people to get a lower blepharoplasty.
Yeah.
We get a little bit of tightening with the microneedling, as we talk, a little bit. But if they have any version of a puffy bag under the eye, the filler is just going to make it look worse. It is just for the hollows, a younger patient that has nice skin elasticity, you can really put it deep. That's my best patient to do tear trough filler. But oftentimes when patients come in, they say, I want filler under my eyes. We have a long discussion about it because it can very often make it look worse.
So is it only when somebody is puffy there that you feel it makes it worse? Or in the article, he's basically saying that if you're older, you shouldn't do it, but if you're younger, you may be okay.
I wouldn't say that. I definitely think younger, better skin elasticity, more youthful skin responds better to tear trough filler. But I wouldn't rule out all older patients or whatever age you consider. But I have several patients in their 50s, 60s, 70s that I still get a good result, but it has to do with the way that their eyes look. If it's sunken, we can fill out those areas that are sunken. But if there's any puffiness, it is not, it could easily make it worse. So, most people do have a little bit of puffiness or, laxity of the skin or bags, basically bags. But the tear trough is a very tough area. And I often convince people that come in saying, this is what I want. I say, let's not do that.
And then do you send them to somebody else to get filled then, or they are usually accept it?
Oh, they usually accept it. No, they usually accept it. I usually say you need we can try microneedling. It'll tighten this a little. Tear trough's going to make, filler's going to make it look a little bit worse, or you just need a lower blepharoplasty if you want improvement.
Yeah.
I'm very honest with my patients because I have had a few that I've done tear trough filler and they have come back puffier and we had to dissolve it.
Yeah.
So I've learned my lesson over the years, really.
How about if somebody has a festoon? Do you treat them any differently?
Festooning, which is that really saggy fat pocket underneath the eye, 100% there. I'm not touching them with filler in that area.
Exactly. Yeah.
I've
seen that where patients, so for all of you who are wondering, we have 3 fat pads in each lower eyelid. There's the medial fat pad, the central fat pad, the lateral fat pad. And the fat basically is inside your eye socket. So this is fat that's around your eyeball, helps to cushion everything in there. And as we get older, that fat can protrude. And as it protrudes, that can create the puffiness that you see. And you can get a dark circle underneath the eye, underneath that due to shadowing from the puffiness. So puffiness is treated surgically by removing that fat. But there's also something called a festoon. A festoon is an area of essential swelling or fluid in the lower portion of the orbicularis muscle, which is a circular muscle around the eye. So there are people who have puffiness of the lower eyelid, and then they've got this pocket of puffiness underneath that. And there's some people who believe erroneously that, I do a blepharoplasty, I remove the puffy fat, that's going to go away too, and it doesn't, because it's fluid basically that's sitting in that orbicularis muscle. The ways to treat that, the most successful way to treat it is you actually cut it out.
Cut it out. Yep.
Yeah, from the front, you literally just cut it out. You cut the skin out with it. You cut the muscle out with it. That's the most effective way. But now you got a scar on the front of your face.
Yep.
And that's why it's not common to do that. There have been so many other things. I've spent 21 years in practice trying to figure out a solution to festoons.
For festooning.
I've gone to conferences with ophthalmic plastic surgeons and stuff, and all these people are saying that they have the solution, and then you find out this isn't going to work.
Nope.
The last one I saw, somebody was saying that they actually go in with a laser and try to heat the skin from underneath the skin, like we were just talking about with that quantum RF. They were basically use a laser fiber there to try to heat it up from the inside, and it's just like, oh my gosh. So many things that people try. People do facelift surgeries where they try to grab that muscle and suture it tighter. I've heard about micro liposuction where they try to suck out, but it's not fat, it's fluid. So that doesn't make sense either.
It's a really tough area.
But the one thing is if you do have that, okay, then do not get filler under your eyes.
Do not get filler under your eyes.
Because that's very common that just all of a sudden puffs way out and it's really hard to get rid of that.
100%. I would not touch anybody with that festooning. And I agree with that article. Underneath the eye is a very tough area with filler. There are very few people that it works well for, and there are some that it works well for, but that's few.
Yeah. So if you're interested in how to treat dark under eye circles, I do have a complete podcast just on that because it's complicated.
It's hard.
It's very complicated because there's a lot of different causes of dark circles under the eyes and all that. So I posted this several weeks back, but take a peek back at the podcast if you're really interested in a deep dive into it, because I cover all the various options, because you have to target the treatment based off the cause.
Yes.
So pigment could be a cause. Hollowness could be a cause. Puffiness could be a cause.
Congestion.
Yeah, there's a lot of different causes.
Genetics.
And I go over all of that. Yeah.
And sometimes it's just genetics. And that is a very tough area to make perfect or, to really get rid of the dark circles.
So we don't do under eye filler in this office. I stopped doing it because I just don't like doing it.
Yeah.
And then my nurses are like, well, if you're not doing it, I'm not doing it.
Yeah.
And so then now we just send them out to other offices.
If you think you're a candidate, you can come see me. I will be completely honest with you. There are still some few patients I do under eye filler, and it's very successful.
How about the brothers? Do the Dr. Brothers inject under eyes?
I don't think Ryan does, but Ross may do a little bit of tear trough filler, yes. What I often try to do is convince people if we put a little bit in their cheek, sometimes putting a little bit in your cheek, when people think they need it in the tear troughs, a little bit of filler in your cheek can sometimes kind of tighten that look, like pull out your cheek a little bit and by giving volume, and can really make that tear trough look a little bit better without putting filler in the actual tear trough.
Yeah.
Yeah.
And you can do, sometimes that goes all the way down into the anterior, the front of the cheek, and injecting that I think can be very powerful.
Yes.
But no, I agree.
Tough area.
There's so many benefits to using red light therapy, especially when it comes to your skin. And taking care of your skin should be important for everyone. Well, that's why I'm so excited to tell you about Bond Charge's Red Light Face Mask. It's a great solution for a younger, clearer looking complexion. Red light therapy is a game changer for your skin. It targets the skin's upper layers to restore glow, calm the complexion, and soften the visible signs of aging. And Bond Charge's Red Light Face Mask lets you do all of this with professional-grade equipment straight to your home. The scientifically backed wavelengths of red and near-infrared light work at a cellular level to energize skin cells and support skin elasticity. Plus, the mask's flexible design contours perfectly to your face. It is so comfortable. Well, I love that red light therapy can help with so many different skin concerns. It's gentler on the skin than other treatments like chemical peels and in-office treatments. Also, some Bond Charge products are HSA, FSA eligible, giving you tax-free savings of up to 30%. Order the Bond Charge Red Light Face Mask today and start seeing the amazing skincare benefits. Trust me, it's worth it. For a limited time, my listeners get 15% off when you order from bondcharge.com and use my exclusive promo code Dr. Youn at checkout. That's BONCHARGE.com. You'll also get free shipping and a 12-month warranty. Go now to get this exclusive offer. That's bondcharge.com with promo code DRYOUN to get 15% off. Okay, next article is from Goop. Is Goop relevant still?
It is. Oh, I have a friend that's obsessed with Gwyneth Paltrow and Goop.
Is it? Okay.
She's a store. She just opened a whole food service now. She's got a whole food delivery service now. Mm-hmm. Goop Kitchen, something like that.
This is from Alicia Rubin from Goop. Can you really get a mini lunchtime breast job? 7 years ago, Heather, a 29-year-old healthcare administrator, lost a significant amount of weight, first through diet and exercise, and later with the help of GLP-1 medications. The change was dramatic and largely welcome. Her shriveled breasts, however, were not. Her experience is becoming increasingly common in the age of GLP-1s. Rapid weight loss doesn't just thin the face or soften the jawline. It strips volume from the breasts, often leaving behind lax skin and little native fat to work with. In response, a growing number of women are moving away from traditional implants and toward lower impact procedures designed to restore volume more subtly. But for many patients, there is practical limitation. After significant weight loss, there is often not enough fat left in the body to repurpose. That constraint has helped fuel interest in newer approaches, including injectable fat derived from cadavers, tissue taken from deceased donors, and injected to restore volume. It may sound extreme, but purified adipose tissue derived from cadavers has actually been used for years in other forms of surgery, Smith explained, noting that it has a very high safety record. Given her autoimmune conditions and reluctance to introduce foreign material, Heather ultimately chose to use her own fat for the transfer. The procedure is straightforward in concept. Fat is harvested through liposuction, purified, and re-injected into the breasts. For the right patient, the result can be subtle and proportionate. It feels natural and integrates well, says Nathaniel Villanueva, a board-certified plastic surgeon in Beverly Hills. Even under ideal conditions, only a portion of the fat persists long-term. About 50 to 70% survive, Smith says. Fat transfer has been performed for decades and is supported by a body of clinical experience. Still, it is not without risk. Complications can include swelling, bruising, and in some cases, lumps caused by fat that does not successfully integrate. These can complicate breast imaging. The patient may need additional imaging or even biopsy to confirm what we're seeing is benign, says Ginger Slack, MD. For patients without enough donor fat, newer materials have entered the market. Introduced in late 2025, AlloClay is an FDA-approved, sterilized injectable derived from cadaver tissue, repurposed into a scaffold designed to create immediate volume and support tissue growth over time. Long-term data remain limited, and questions about safety, particularly around inflammation and breast imaging, are still being studied. For Heather, the decision ultimately came down to familiarity and control. I liked that it was my own tissue, she says. The change was not dramatic, but it was enough. I finally feel like myself again. So are people in the dermatology community talking much about AlloClay?
They're not.
Not yet?
Not yet. I mean, I've read a few articles about it, but not a lot because, we don't usually do injections, breast injections or, breast surgery on a regular basis. Or
but
breast
it can
procedures.
Be used for the face.
For facial,
it can
for
be
facial.
Used in the butt.
It has not taken off yet in the dermatology community. I think our hyaluronic acid or our profile of fillers that we have are so wonderful right now that that it's not a huge need for a new type of filler. And we've talked before about the ethical, situation with this AlloClay and, cadavers and where they're getting it from and so on. So I think people are probably more hesitant to really dive into it. I don't know what it's like in the plastic surgery community, but
so it's being used definitely as BBL. So people who want their butts bigger. So that's, I think, where it's used most. Some doctors are now apparently using it in the breasts. I'm always very hesitant to do anything into the breast that hasn't been done for a very long time with the potential risk of breast cancer. And so this patient that they followed ended up having fat grafting to her breasts. And she was happy with it. The issue with fat grafting, the doctor said 50 to 70% of that fat will stay. Yeah. My impression is closer to 30 to 50% may stay. I think that's overstating how much truly stays in the breasts or other really parts of the body. And I think that, the belief now in the plastic surgery field is that, initially when they were talking about fat injections to the breasts, our American Society of Plastic Surgeons actually issued a statement condemning the practice. And the concern was, how is that going to alter mammogram and breast surveillance? I think as doctors and radiologists have felt more comfortable reading these types of things, that concern has kind of fell off. It's not as much of a concern anymore. And so a lot more doctors are injecting fat into the breast routinely. I myself, however, the thing that they haven't addressed though is the fact that stem cells, the fat is filled with stem cells. And yes, there are studies that show that are like 3 to 5 years out that, the fat that you inject into the breasts doesn't appear to usually create, major changes on the mammograms that can't be determined, that they're benign. But how long does it take for a breast cancer to develop? And is there any chance that if you're injecting a bunch of stem cells or fat rich in stem cells haphazardly around somebody's breast tissue, how do you know that you're not going to inject it around a cluster of dysplastic precancerous or early cancerous cells, and you're not going to cause that cancer to grow much more quickly?
Right.
unfortunately, studies like that, you'd have to, follow out for 30 years
Yeah.
to know that.
Correct.
And to compare it. And they just aren't doing that.
Yeah.
And so it's something that has not been addressed amongst plastic surgeons. And unfortunately, I feel like some people have, I think in my field, and I'm not sure with yours, but we've always, I think, been I guess are guilty of, in general, oftentimes putting cosmetics before health. And saying, I'm so excited about this new technology, this new treatment that's going to do this and that, and then not thinking about potential long-term ramifications of what you're doing to somebody. Because, oh my gosh, look at this great result. Look at what's in front of you right now. But like, well, how's it going to be like 10, 20 years from now? It's like all the fat that people are putting into butts. How's that going to be like 20 years later? Where's that fat going to be? Is that still going to look like a nice badonkadonk, or is it going to be hanging down the back of their thighs and they're going to regret doing it?
I have so much to say, because a couple things regarding that last point you just said. I have seen patients that have had fat transfer, especially in their faces, done, where they come to see me for fill or whatever, and that fat has settled. So they have little lumpies, little lumps of these little collections of fat that they've had injected before, and I can see it right away. So that's number one, where I think, again, the fillers are better for situations like that. For body injections, I always think the same thing that you just said. I think, what would I do if it was my body, right? That's always what I think. And excluding the company that we're in here, we're both cosmetically focused physicians, but I think we both also put health first. As a person, in my personal decision, I would never, ever have something injected into my own breasts for any reason at all. There's, again, we can go into a whole body self-esteem situation, but it's really just long-term health possibilities of, obscuring screening, exams, MRIs, breast mammograms, to me is never worth what a bra can do. In all honesty, and not to take away from what you obviously is probably a big part of your business and your practice, and the general population, but I am of the personal, feeling of, why would you do something that could long-term affect screening for your health, when, there's so many, the bra industry can give you boobs that you don't, and I know it's not when you're naked, but, I don't know.
Well, I think that there too, some people may disagree with me, but there's a safety profile with implants that,
yes,
if you get breast implants, yes, you can have
implants
complications
excluded.
And stuff like that, but it's not going to increase your risk of breast cancer.
Right.
If anything, technically, women with implants actually have a lower rate of breast cancer than women without, interestingly, but it could just be yourself selecting for a group of people who are image conscious, who may take better care of themselves than the average person.
Yeah.
But with fat injections, like I'm all for fat injections in the face. If you want to do in the butt, that's up to you. But the breasts, I think you have to treat very differently.
Agree. And filler too. With fat, with filler, with this alloclay, whatever, any of it. I think that just injecting anything to the breast, I would really, and from a personal standpoint, I would caution people to really think hard about doing something like that.
I 100% agree.
Yeah.
Okay, so this is a story about Kelly Ripa. Kelly Ripa gets cheeky about the time she got microneedling done on a specific part of her body during quote-unquote desperate times. This is from People magazine by Michelle Lee. Kelly Ripa is breaking down the stigma surrounding getting work done in an unexpected area. In a new episode of her Let's Talk Off Camera podcast, the host and her guest, Lucas Gage, got to chatting about microneedling. And Ripa said she got it once in an NSFW, not safe for work, area of her body. Ripa, 55, confessed that she underwent the treatment, which is typically done on the face, on her ass cheeks. Instead of giving her bum a youthful appearance, the microneedling didn't actually do anything because it looked, quote, as old as before, unquote. However, quote, desperate times call for desperate measures, unquote. When Gage complimented Ripa's glow further in the episode, she credited to plastic surgery and warned the White Lotus star to never go near filler. You hear that a lot from Hollywood. Don't go near filler.
Of course, I know. And
so have you ever microneedled somebody's butt?
We have microneedled most places on the body, but never, I don't think, on someone's butt. Although we have done it over cellulite areas. Not that it does much.
Okay,
and I like the honesty with Kelly Ripa there, because I've microneedled, above people's knees, like the little loose skin that comes above.
Does that do anything?
That's exactly where I was going with this. Not much.
Yeah.
Not much. It does such wonderful things for the face. It does subtle textural changes. It gives a big improvement for the face, for the neck, really thin skin areas. But I really don't think it does a lot. Okay, there are some, if it's a small area, and it depends on the texture of the skin. If it's a fine scar, very fine stretch marks, I do find that there's some improvement. It's not going to take away those things, but it definitely gives improvement. And we have a lot of patients that come regularly for microneedling of their body scars, of their stretch marks, and they do think that it helps. your overall, is it giving you a huge improvement for anywhere, like on large surface areas of the body? No, it's really not. And it has done nothing for cellulite. I've tried it on myself, hasn't done anything for cellulite. It doesn't go deep enough.
I think cellulite's too deep.
It doesn't go deep enough. So very surface textural changes on thinner skin, helpful.
You can microneedle your butt, I guess makes it smoother.
Yeah, it's not going to harm. There's no harm in doing microneedling. I've not seen any issues. We do radio frequency microneedling. We've never had any complications from it, but because it's so superficial and shallow.
Yeah.
But at the same time, for thicker skin, I think it's really more of a thinner skin that it works better on.
We do it mainly just on the face. We started doing a little bit on the scarring and stuff. We haven't really much in the past, but
hands it works well for too, Tony. It actually works. We have a couple patients that we've done hands that they look amazing.
And what does it do specifically for the hand skin?
It tightens the skin, like it basically just like anything else. This crepey fine skin, it gives you a little bit of tightening, and we do that with a little bit of filler in the hands. It really can rejuvenate the hands.
How deep do you go with it?
The deepest that we can go, which is I think 0.3 on our machine. I think we have a 0.3 on our machine, or 3 millimeter on our machine.
3 millimeter.
3 millimeter, not a 0.3. Oh, 3 millimeter on our 0.3.
Then that'd be bleeding afterwards.
Yeah, a little bit of bleeding. You need that fine print. You need the little fine pinpoint bleeding.
And you just use topical numbing medicine for that?
Yeah.
They tolerate that okay.
I usually get it done without the numbing medicine.
Well, you inject your own face.
I know. I don't need the numbing medicine.
So I've done Botox, but filler is I have a little bit of
a don't be a wuss attitude in my office. If you're going to come see me, just a heads up.
So, what we really, in the end of this episode, the most important thing is we got to make sure that your husband washes his face if he's in the lake.
I can't wait till
And when he gets home, before bed, he has to wash his face at least. Like I have to take a shower if I'm in the lake all day and
I will give you follow-up at our next podcast.
Let us know.
If Peter is doing that.
Everybody's going to be wondering, is Peter washing his face at night if he's in the lake all day and putting a sunscreen on, or is he seriously going to bed
right to bed? Let's see if we can get him to change. We're going to do an intervention when I get home.
So where can people find out more about you and visit your practice, as well as the brothers, Dr. Brothers?
Yep. I have 2 Dr. Brothers that work with me. They are brothers, and their last name is Dr. Brothers, and they're both wonderful. My practice is called Northwest Dermatology Group in Covett Med Spa. We are in Bingham Farms, Michigan. Our website is www.nw-derm.com. And then our Instagram is northwestderm_Covett Med Spa.
Which they never update their Instagram. I swear to God, I posted, I think, on our last episode, and it's been like 2 weeks and they haven't accepted the collaboration, but that's okay.
I love that Tony has me on this, but I am the anti-social media.
On their website, you can actually make an appointment with one of the Dr. Brothers through the website, which is very convenient. But you can't make an appointment for her. You got to call the office to make an appointment for her, which is the same thing in my practice. You can make an appointment with my injectors and my estheticians through our website through an app. But you can't make it with me because the wait list is long. We got to figure it all out. So, well, thank you so much for joining me.
Thank you for having me.
And thank you so much for watching and listening. My name is Dr. Anthony Youn. This is a Dr. Youn Show. Once again, if you enjoyed this podcast, if you could take a minute of your time to leave a rating or review, it definitely helps me spread the word. And every week we'll give a shout to somebody who does. Otherwise, I'll leave you with this. Adopt, don't shop, save a life today. Thank you so much for watching and for listening.